my mom and dad in India, and I cried for 3 hours. There was that potential where if you could do something innovative, if you could do something that could serve the population well, it would really take off. It will do really well. I opened that and I read just the first line that we are pleased. And that's all I read. My name is Dr. Sanjiv Pathak, and I work as a dentist in Australia. I have got a private practice, a group of private practices. In fact, the name of the clinic is Smile Sensations. It is a general dental clinic, and it also happens to be an implant center. Something that came to my mind a few years ago. In fact, now that I say few, I think about it. It actually goes back about 10 years now that we set up the implant center. And that was primarily with the intention that we were able to provide general dentistry, but along with that also provide highly specialized, good quality implant procedures to the patient from end to end, starting from doing restorative work to the surgical side of things. But anyways, look, so I'm the senior dentist there. I'm also the CEO of the company, as in I'm the executive officer as well, which means that I look after and manage the admin side of things with my team. We have got a group of 19 professionals, 19 clinicians who work with us. We have got about 12 dentists and about 7 oral health therapists, which essentially says that our preventative care with regards to the oral health is very important, that we value that a lot, along with all the other complicated treatments, complex treatments that we do. My journey in Australia, it actually started back in 2008. In fact, the whole planning started back in 2007 when I was actually planning to go to UK. Where my elder brother was then, and he's a doctor, and he had just moved to the UK then, probably about a couple of years ago from there, and he was my main reason why I was thinking, okay, I should move overseas. He always mentioned that there was a better lifestyle and better working conditions compared to what we were seeing in India. So it was like, okay, let's go abroad, let's explore some options and see what's life presenting to us. So I started preparing for the exams there, but as it happened to be at that time that they changed the whole exam pattern. And from there on, it almost seemed like almost impossible to get into the UK. And that was the time when my brother also decided to do his specialty. So he moved to Australia pursuing that because he wanted to get into cardiology. And as he moved to Australia, because obviously Australia was a country which was brighter, which was sunnier, better weather, bigger homes, that sort of thing. And he said, oh my God, Sanjiv, this is an absolute paradigm shift. This is such a fantastic country. This is a foreign land we all dream of. So Australia is the place to be. So I was like, okay, fantastic. Let's try that. So I went through that whole process where I actually did the language exam. We have to do an English exam first. So we did that. And as it happens to be, it actually worked out really well. That exam, I found that it was a difficult exam, but yeah, I was able to crack that pretty easily, and it was all good. And then started the journey of the Australian Dental Council exam, where I did the part 1 exam back in India itself. And I prepared for the exam, and I went to do the exam, and I really need to share this because I share this with everyone, that how my experience with the part 1 exam was. That the part 1 exam back then used to be, there used to be 2 sets of exams, which were 2 hours each. And one was the MCQ based exam, and the other one was a short answer type question. By the time I was actually sitting the exam, there was so much on stake. It was actually my girlfriend then, my wife now, she was actually already doing her post-graduation. I had decided not to do that, and because I wanted to go abroad. So she was already doing post-graduation, and coming from our culture, there was a big pressure on me to prove myself, to do something, So I prepared for the exam, I really worked hard to prepare for my ADC. And then I got into the ADC exam, and I went for the exam. I still remember that. It was a 2-hour first paper that you have of the MCQ test. And the exam started, and 20 minutes later, I went and handed over the answer sheet to the the invigilator. And the invigilator was, look, sorry, mate, you cannot leave the center in the first hour. You can't go for a toilet break in the first half an hour of the exam starting. And I was like, sorry, sir, I've actually finished the paper. I was so over-prepared that the 2-hour exam, I actually finished within 20 minutes. I was like, I'm done. And they were like, are you sure? Because you won't be able to come back in. And I was like, look, I'm 100% sure about that. So that's how it happened. So that paper was obviously a fantastic one. Then the second part, the results came through. I was quite expecting that I would do well. And obviously I passed the exam. And then the move to Australia, I still remember Anzac Day was the day when I came here back in 2008, 25th of April, when I came to Australia, came to Canberra, in fact. And a lot of people still question that, they would still be saying, why of all the places in Australia, you would come to Canberra, which is probably the coldest of all the cities, like as in weather-wise. But look, I love Canberra. I always feel that Canberra is a fantastic place to be. It has got a perfect mix of the regional and the modern living, which is fantastic. But anyways, I came here and within 10 days, I had to go to Melbourne to do a training course for the ADC. Back then, ADC was not quite the way it is nowadays. There was very, very little information online. There were not a lot of people who were doing the exams back then. This is going back like 16 years now. So yeah, I came here, I did my preparations the way I could, and then I went and did the course, went to Melbourne and did the orientation training course, OTC as they used to say back then. I did the course. I went there, and I must say that the first day when I went to do the course, that was a Royal Melbourne Hospital. I attended the course for the first evening. They used to have evening sessions. I came back to my room. I called up my mom and dad in India, and I cried for 3 hours. Everything was so alien to me. The way they were practicing, the way they were doing the things here was so very different it was the same truth. Obviously, it is the same truth. It's a human being we were treating. But the way it was done, the conditions here were completely different. My mom and dad, they were there on the phone with me, and they were like, okay, Sanjiv, don't worry about it. We are confident you will do well. And it was a lot of morale boosting. 3 hours, after 3 hours of that, I was like, okay, I'll give my best shot. And that was the day. From there on, I actually thought, look, there are a lot of people with a lot of expectations. I have got something to do here as well, and to prove that I am actually capable of doing something really extraordinary. I still remember the time when we were preparing for the exam. I did the root canal treatment session that was there in the training session. And there was something which was actually quite complicated. And as it happened to be, and I'm not trying to brag about myself, but I did it actually quite well. And I was like, and I happened to just say to the other candidate who was just sitting next to me, and I happened to say, I don't know why it sounds so confusing to everyone. And he was like, he just patted on my shoulder and he said, look, wait until you do the exams 2 or 3 times and you would know why people say that. And once again, I was like, the person who had come back to the course thinking, oh my God, I'll do it nice. I was like, oh my God, it looks like I'll have to do this exam a few times before I pass it. But now, look, fair enough. It was all good. I did the exam, and it was quite a journey. ADC exam used to be quite a lengthy exam back then. It used to be like a 6-day exam of about 6 days of about 6 to 7 hours every day, where we had to actually work on the patients. We had a theory exam. Then we had a practical exam, as in working on the patients in the patient's mouth. And I did all that. They used to take about a week to come back with the results. Still very, very vivid in my mind. The results came out. I went to the letterbox, got the result out. They used to send it out as a post. I opened that and I read just the first line, that we are pleased. And that's all I read. And I threw it up in the air and jumped onto my brother. And I was like, oh my God. And we were like absolutely crazy. That was that day, and that's it. And this is where we are now. And from there, the journey began. I went and gave interviews at Smile Sensation. Dr. Atul Manani, who was there, who was the principal dentist then, I went and did the interview with Dr. Manani. I had a few more offers back then because Australia, like as I said, in Canberra, there were not that many dentists as we have now here. So obviously we had multiple offers on plate. Me and my brother, by the way, I have to mention that my elder brother is my mentor for life. He's now, just to put things there, that he's now a very renowned cardiologist, intervention cardiologist in Canberra. So he has always been my mentor. And so we sat down together, we looked at all the offers, and we thought that probably Smile Sensations was the place to be. And that's where the journey of dentistry started for me in Australia, in Canberra, as an employee dentist. And I always thought that my main intention was that to try to, especially in the early days, try to somehow think of it in a way that it is the same, like as I said in the very beginning, the same thought that I had when I was doing the course to when I started working as a dentist here. Was I thought, look, it is the same human being. It is the same tooth. It is a different environment, but it is the same tooth which I have worked on, which I have practiced on so much. So not to get affected by the conditions, work to the conditions, but try to perform the best of what I can. That is what my whole intention was in the early few years of it. Definitely, I did a lot of professional development courses, went on to do some CPD trainings and things like that, did my postgraduate implant course with the Charles Sturt University in Orange, in Wagga Wagga here. And then after 5 years of working as an associate dentist, once, as I had mentioned, I'm not sure if we have discussed about this before or not, but I really wanted to mention that after 2 to 3 years of working as an associate dentist, I thought, look, this is fantastic. This is a great place to do clinical work, but there was so much opportunity also as a business opportunity. It was a great industry to get into because it had massive scope of improvement and growth. And I always felt that it actually worked as a blessing in disguise, me coming to Canberra, because like as I said, Canberra being the capital city, it is not very crowded. It did not have a lot of dentists back then. And so there was that potential where if you could do something innovative, if you could do something that could serve the population well, it would really take off. It will do really well. And so at that time, that's when I thought, look, this is something that I have to start thinking and train myself into. After a couple of, like as I said, after 3 years of that, I was ready. But then I thought, look, if I want to get into this, I don't want to get into it undercooked. I want to make sure that I'm 100% ready so that when I get into it, it is a smooth sail. And so I waited another 2 years. I took my time. And then back in 2013 was when I went and approached Dr. Manani. I mentioned it to him and I told him that, look, now I'm ready to get into the business side of things along with the clinical work. Dr. Manani being an absolute gentleman, he always, he's a fantastic human being, by the way, just letting you know. He's a great person. Like as I said, he's a great human being. More than anything else, he's a fantastic clinician, no doubts about that. But overall, he's a fantastic person. And so what he said was, look, Sanjiv, why not we join hands together and we try to grow Smile Sensations together? And that was great. That is exactly what I wanted. So from there on, we joined hands together. We got into a partnership, and from there on, it's been a journey, strength to strength. We went on from having Smile Sensations in Manukau, which is still our mothership, the main clinic, to getting to the Jerrabomberra clinic, which is just New South Wales at the border of Australian Capital Territory and New South Wales. That was our second clinic. And from there on, we got into the habit. We got addicted to having new clinics, developing a business, building a patient base, providing quality service to the patients, and developing a system which was easy for everyone to follow, getting into a management team developing a management team. And here we are. We have got 6 dental practices which are fully operational, and we have got 2 dental practices which are actually in the pipeline. And so that's been my journey. It has been a fantastic journey. Look, I must say I count my blessings for that, and I'm very proud of it that we have achieved what we have achieved now. And yeah, so that's my story.